Did you know that when you experience high blood sugar, it is called hyperglycemia, and when you experience low blood sugar, it is called hypoglycemia? The symptoms of both vary depending on whether you have hyperglycemia or hypoglycemia. Let's find out about low blood sugar versus high blood sugar. What level should your sugar level be at? What blood sugar levels are considered normal? According to the Merriam-Webster Dictionary, one definition of normal is conforming to a type, standard, or regular pattern. It's a term that not everyone takes kindly to, because if you're not normal, you might be considered abnormal, which means unusual in an unwelcome or problematic way. Rather than thinking of your blood sugars as being normal or abnormal, you might think of them as being in range, in target, or at goal. After at least 8 hours of not eating or fasting, blood sugar levels are less than 100 milligrams per deciliter. And 2 hours after eating, they are less than 140 milligrams per deciliter. Just before meals is usually when levels are lowest during the day. Before meals, blood sugar levels for most people without diabetes range from 70 to 80 milligrams per deciliter. While 90 milligrams per deciliter may be the norm for some, 60 milligrams per liter is the norm for others. Even with prolonged fasting, the glucose level of many people will never drop below 60, and the liver also maintains your blood sugar levels while you diet or fast by converting fat and muscle to sugar. High glucose levels happen when the body can't properly use the insulin it already has or doesn't produce enough of it to transport glucose from the bloodstream to the body's tissues, muscles, and organs for energy. As a result, the blood sugar level increases. Unhealthy sugar levels are sugar levels that are greater than usual. Prediabetes is the medical term for blood sugar levels that are higher than normal sugar levels, but do not yet indicate full-blown diabetes. According to the American Diabetes Association, 86 million Americans are estimated to have this condition, which, if you don't make the healthy lifestyle modifications that your doctor advises, might progress to diabetes. Although not as much as diabetes, it also increases the risk of heart disease. With proper food and exercise, prediabetes can be prevented from developing into diabetes. The cells in your pancreas that produce insulin slowly lose their ability as your blood sugar levels rise. The organ overcompensates, resulting in persistently high insulin levels, which the pancreas suffers lasting harm over time. High blood sugar levels can bring about changes that result in atherosclerosis, or the hardening of the blood vessels. High or low blood sugar levels may take a while to treat, but subscribing to our channel will take you only a second, and plus, you can get all the useful, helpful, and relevant health and wellness information you need right here. What does low blood sugar mean? Low blood sugar levels occur when your body's ability to continue providing glucose to your organs, muscles, and tissues is compromised. Your blood sugar can decrease quickly if you don't eat enough or skip meals, take too much medication like insulin or tablets, exercise more than normal, or use certain drugs that lower blood sugar. When people lose weight or acquire kidney issues, they may not require as much insulin or other medications as they did prior to the weight loss or kidney issue. Rather, they risk having too low blood sugar. You often experience low blood sugar symptoms when your blood sugar level falls below 4.0 millimoles per liter, where symptoms could develop within 10 to 15 minutes. Having high blood sugar can happen suddenly or over the course of several days. Some of the signs you may experience include high amounts of blood sugar, over 200, severe thirst, fatigue, sleepiness, frequent bathroom visits, grouchiness, and stomachache, either with or without nausea or vomiting. Hyperglycemia usually gets triggered and caused by too much food or eating the wrong foods, not enough diabetes pills or insulin, illness or infection, or not enough exercise. But make not exercise if your sugar is above 240 and stress. In order to avoid hyperglycemia, you can take some preventive measures, such as checking your blood sugar at least every 4 to 6 hours and checking your urine for ketone levels if you take insulin. If you have moderate to high ketones, you will have to call your doctor right away. Drink 8 ounces of sugar-free fluids every 1 to 2 hours if your blood sugar is over 150. If you are vomiting and unable to eat or drink anything, call your doctor. If your blood sugar levels continue to be higher than the prescribed levels after 24 hours, don't also forget to notify your doctor. Low blood sugar or hypoglycemia usually happens quickly and may require that you seek immediate help. Some symptoms of hypoglycemia include sweating, shaking, your heart pounding fast, fainting, hunger, irritability, or confusion. Some causes of low blood sugar also include too much insulin, eating less or missing a meal, exercising or engaging in extra physical activity. And just like hyperglycemia, hypoglycemia can be prevented. So what do you do to prevent low blood sugar? You can first of all test your blood sugar to know what level your blood sugar is on. If you feel too shaky, eat or drink fast-acting carbohydrates such as 4 ounces of juice. It could be orange, apple, cranberry, or grape juice. 8 ounces of skim milk, 3 glucose tablets, sweet tart candies, or 2 tablespoons of raisins. Until blood sugar is above 100, make sure to check it every 15 to 30 minutes. If necessary, consume a second fast-acting carbohydrate. If it will be more than 2 hours before your next meal, have a snack, such as a sandwich or a peanut butter cracker. If you're unconscious, someone needs to dial 911 immediately, and you shouldn't be given anything by mouth. In case your medicine needs to be altered, make sure to let your doctor know about this occurrence. Even while not all of your blood sugar readings should be at goal levels, issues are less likely the more closely you maintain them within your target range. Avoiding too high or too low blood sugar levels will help you prevent negative symptoms and health concerns. That's all for this video. Thanks for watching. Interested in learning more about blood sugar? Check out this video, Foods for Treating Low Blood Sugar. Best snack for low blood sugar.